public health emergency response. We currently have 3 public health emergency response operations going on. Okay, good morning. Welcome to the CDC Emergency Operations Center. My name is Ed Rouse. I'm the Senior Advisor in the Division of Emergency Operations.
So this is the Emergency Operations Center at the Centers for Disease Control and Prevention. We were activated on January 21st as part of the response to the coronavirus epidemic. Now, work responding to coronavirus had begun about 3 weeks earlier than that within the programs that normally handle coronavirus disease. But as the epidemic continued to expand, we felt that it was important to expand our response as well. And this really represents an agency-wide response. Over 800 people are working specifically on coronavirus right now. Only about a third are actually in Atlanta. They are working in cities around the United States and even outside of the U.S. Phone calls and get work done.
So they can make the quick split-second decisions they need to make without the bureaucracy.
As much as possible. Yes. Comparison, let's say the 2009 H1N1 pandemic, that was something that really arose here in the homeland. So that was a different. Based on what we're seeing right now, it's behaving very much like a new influenza virus. So looking down the road, this could be the equivalent of a mild to moderate influenza pandemic, or maybe even a really bad influenza season. But again, that's based on very limited data, knowing what we know right now.
Has been in business. This emergency operations.
The data that has come out of China suggests that the hospitalization rates and the mortality are not that far different than influenza. And so, you know, the greatest misstatement in medicine is it's just the flu. Flu is actually a very serious infection. Most people get it and recover, but because most people are susceptible, the impact can be huge. Well, the continued escalation of the epidemic in China was sort of just within a day of that.
There have been some concerns that your agency has expressed about some of the testing.
This appears to be a much milder clinical illness than SARS, and certainly much more than MERS, the Middle East Respiratory Syndrome. But that said, I don't want to take away any of the concern, because we're responding vigorously to make sure we can stay ahead of this as much as possible.
The staff, the cost, which is a lot of factors.